My name is Deborah Campbell. I'm going to talk about school-based mental health services in Oklahoma. I hope that the public contacts Ryan Walters, who is the state superintendent of instruction, and every member of the State Board of Education and demand that this program is shut down immediately. Before I can talk about Oklahoma, you need some background. So the CDC created a global model called Whole School, Whole Community, Whole Child, primarily funded with federal and grants from AWARE. The model allows the education institutions to determine what educational mental health information is age appropriate, determine what is in the best interest for your child, and provides mental health and medical services on the school premises, including gender affirming care. Parents are not required to be with their child when they're receiving these services. They also transform the schools into school-based health centers. Pay attention to the keywords health centers because that is telling you that they're providing both medical and mental health. In the blue states, they implement health centers. In the conservative states, they bring it in two phases. Phase one is mental health services. It's easier because they play on your emotions. Then phase two is the medical services, which is much harder to implement. May of 2023, the Governor Stitt, he signed into law Senate Bill 613. 613 prohibits the gender transitioning of minors. It prohibits the pharmaceuticals, prohibits the surgeries. However, the Oklahoma legislators compromised by allowing gender affirming therapy. When the governor signed this into law, the ACLU immediately filed a lawsuit saying this was discriminatory. It's called Poe versus Drummond. I recommend everyone look at that and look at the plaintiffs. You will see an extensive list of medical people, professionals from that industry, and just a handful or a sprinkle of parents as the plaintiffs. Now, if the ACLU prevails, that's going to trigger phase two in Oklahoma for the medical services. Therefore, if trans children are getting therapy, gender affirming therapy, phase two kicks in, then the psychologist or psychiatrist can make a referral to the medical end of it. So the kids would have access to puberty blockers, cross hormones, and surgeries. Other concerns, it it destroys parent-child bond. It creates social contagions like gender dysphoria in young girls, eating disorders, and so on. So those are some examples of social contagions. It causes delayed trauma. It indoctrinates children in groupthink. It promotes the gender ideology and gender affirming care. Also, there's no evidence-based research that this improves academics, literacy, standardized scores, or attendance. There's no evidence that it reduces suspension, juvenile justice involvement, and no evidence that it increases self-reported substance use. Then you have program consistency. It does not exist in Oklahoma. And I want to point out, not only this program has no consistency, academics There's no consistency in the state of Oklahoma, and parents should be upset. Every school district is doing their thing. So again, this is a problem. Program consistency. But getting back to school-based mental health, each school district is responsible for creating their own policies, curriculum, and protocols. They can contract with nonprofit organizations to teach it. So the education component can be taught by Planned Parenthood, GLSEN, SECUS, any of these organizations that promote gender ideology. Or the school district can use the WSCC protocols, research, and education videos. And I recommend that everyone go in that library on that website and you look at those videos. It will upset you to see what the teachers will have access and the ability to use. Now, the proponents for this whole thing, they use emotional narratives. And the one that really upset me is when they say parents can't be trusted to meet the mental health and medical needs of their children. Therefore, school-based health services ensure that every child's needs will be met. That's quite arrogant. And look how they promote it on the basis of convenience for the parents. They don't have to take off from work. Kids won't have to miss school to go see a doctor or a therapist. So that, again, that is concerning. Now, there were several laws that laid the foundation for this program back in 2021. And keep that year in mind when we get to funding, because there's questions that come up. So Maria's Law was codified, and these were the sponsors of that bill. So with election time, keep that in mind. Then you have House Bill 1103. Here, there's the sponsors. And this one set up the Oklahoma Prevention's Need Assessment Surveys. And the question is, why is it biannual? And why is it that the schools are doing the work of the Department of Mental Health and Substance Abuse Services? Because that private and personal information, when those kids fill out those surveys, that data is put into a database and sent to this agency as well as the U.S. Department of Ed. We don't know who all has access to that and what the repercussions will be when the kid graduates from high school. House Bill 4106, this gets into the mental health crisis. And then you have Senate Bill 89. It creates the requirement for micro-credentials and professional development for teachers and mental health providers. What's concerning about this, the micro-credentials apply to comprehensive sex ed and to school-based mental health. So teachers who are going to be teaching the subjects, the education component, they have to go through professional training and they have to get their micro-credentials in order to do so. Also, the education component of mental health will be integrated in programs, or the school can just do a standalone program. Now, funding. This will blow your mind. Now, I only listed a few grants that Joy Hoffmeister, who was the previous state superintendent, there's many more grants. But look at the date. As far back as 2018 to 2022, all this money that was applied for and received had to do with creating the school-based health services. However, the laws weren't codified until 2021. So what happened to the money? What did Hofmeister do with all this money? And I suggest everyone contact Governor Stitt and demand a forensic audit from 2018 to 2022 and find out about this money. This is a heck of a lot of money, and there's much more. Then we have fraud and abuse of Oklahoma-based Medicaid. And this is very concerning. You're going to see a surge of unlawful IEPs for anxiety, depression, gender dysphoria, and other disorders that are not recognized under IDEA. That is the Individuals with Disability Education Act. There's concerns about intentional and unintentional fraud. And you're going to see an escalation of children being enrolled into Medicaid. But let me briefly talk about the IEPs because most people don't understand this. So under IDEA, in order to get an IEP, the child has to be eligible, and there's two criteria for this. You have to meet one or more of the 13 disabilities recognized by IDEA, and the disability has to adversely affect the child's education. And what you will see is anxiety, depression, and gender dysphoria is not a recognized disability category. Now, call for action. I recommend parents make a written objection and withdrawal on the basis of harm from participating in school-based mental health and medical services. Also include in there any activities, instruction, programs, and courses. Because remember, this will be integrated into some of the required courses. You can also make the same written objection that your child will not participate in sex education. Because again, sex education can be integrated into other courses. You can also identify in your letter of objection that your child will not participate in LGBTQ integrated curriculum. And again, integrated into required courses. So parents, you do have an option, take advantage of it. And if it is a required course, they have to provide you an alternative. And remember, the key word is harm. Your withdrawal has to be based on harm. Then I recommend that the public, that they tell Ryan Walters and the State Board of Education to immediately terminate this program. Contact Ryan Walters and the governor and demand an abuse audit of the Oklahoma school-based Medicaid for every public school, and for the governor to perform a forensic audit on Hofmeister from 2018 to 2022 regarding the grants and funds setting up this program. Because one of the things that you can see in articles written a few years ago, Hofmeister took a lot of this money and started hiring over 800 school counselors, school psychologists, and so forth, well before they started creating the program. So they chose that over hiring teachers and giving us smaller classrooms. So please do your homework, do your research, get involved, and I appreciate your time. Thank you.